Good evening. This evening we're going to be doing our training on Identity Matters. The target staff that we're going to be targeting is front-end clerical staff, administrative staff, the staff that registers our patients. We are going to be introducing some new boxes on our form that we already use to get patient demographics. These two new boxes will include what sex is on their birth certificate. Is it male or female? They will mark that, whatever they were born as, and that's what's on their birth certificate. The next box will include what gender they identify with. Do they identify, is it a male identifying as a woman or vice versa? The form will also ask what is their preferred name. Like my name is Dawn, but who knows? I may like to be called John. So we're going to they'll be able to put that on the form. The patient will be able to write that on the form and the clerk will input that into the computer. This will save a lot of time for the doctor. The patient won't have to feel like they have to tell the doctor, hey, I prefer to be called John instead of Dawn, and give a whole explanation. Why we are going to start giving this form, or adding these two boxes to our new form and doing more training, it is our responsibility to provide the best possible care to all of our patients, not just some of our patients. We need to identify with all patients. Identity matters, and we want our staff to respect all of our patients by acknowledging their identity. Patients have done a survey throughout the years and they just don't feel comfortable coming in sometimes to a doctor's office. They feel they're going to be judged and not heard. Let's talk about the difference between sex and gender. What is sex? Sex is what you were born with, either vagina or a penis. That is it. That is what sex is. Gender is what you identify with, such as a man or a woman, or how a person views themselves, or their gender identity. Some men identify with being a woman, and a woman identifies with being a man. Some don't even identify with either of those two. Gender refers to the behaviors and meanings that society assigns to the male or female, based or perceived on environmental, economical, political, historical, or cultural forces. Genders other than male or female may be socially recognized. How our multicultural society includes individuals who self-identity as transgender, intersex, third gender, immediate, post-gender, or transsexual. We will be discussing in a future training what those meanings are, and the pronouns that go along with those meanings. One of the challenges let's go over an example. One of the challenges our healthcare staff can come across. George, a transgender man, finally gets up the courage to come in and have his pap smear. He finally worked up the courage to walk in the clinic and get his preventive health care. When he tells the clerk, hey, I'm here to get my pap smear, the clerk looks at him and she says, pap smears are for women. Oh my gosh. Well, George looks around and all the other clerks and the people in the waiting room are kind of laughing and snickering, so he runs out of there. He's gone. He's out. What did our staff do wrong in this situation? What didn't they do wrong in this situation? They assumed about George's assigned sex at birth. What that clerk said was not appropriate to say to anybody. What could have been done differently? George's reason for getting a pap smear is not our business. None of our business at all. We are there to get the patient checked in, get their information, get it inputted into the computer, send them on their way to get their care. It is not our business to be saying, hey, you should identify with this gender. That's not right. That's not an appropriate procedure for your gender. I mean, that's not cool at all. What could our staff have done differently? If we don't see George's name on a George Alvarado honor schedule, we could have said, hey, George, or hey, do you go by a different name? Or do you have a driver's license I can look at, and try to find the patient with that information? The way we can educate our staff more about lack of gender-based prevention, management, and therapy. With our staff not being properly trained on gender-based prevention, it can negatively impact our patients, like it did George, I'm sure. And he walked out and didn't get the care he deserved. As of 2015, the consequences of inadequate treatment are staggering. 54% of transgender youth have attempted suicide, and 21% resort to self-mutilation. That's awful. That is so awful. If I had a child that, identified with the other gender, I would want them to be able to go into a clinic and get the care they deserved. With this new form, the patient will just be able to mark the information privately, discreetly. The clerk can input it into the system, and the doctor, the nurses, the clinical staff can see that when they're looking at the chart. That way they can know a little bit more about this patient before they come back there. More than 50% of persons identified as transgender have used injected hormones that were obtained illegally or used outside or conventional medication that were obtained illegally or used outside of conventional medicational settings. So that means they went out probably somewhere in the black market or something and found some sort of drug they needed and used that. That is not safe at all. The new approaches that our facility is making is going to be more training for the staff on identity matters. We will be changing all the bathroom from men or women's to all genders. You can use either or bathroom. It's not going to be just in those two little boxes. Anyone can use the bathroom. Language should be inclusive, allowing the patient to decide when and what to disclose. That is their business. They can tell us what they want to tell us, but we should not be asking or judging. There will be more training for the providers on this gender identity matters as well, on medications that they can offer the patient, screening, surgeries. If the provider does not feel comfortable seeing different types of patients, they need to let the patient be aware of this so the patient can find the care that they deserve. Or they need to go talk to the head of the hospital or human resources and let them know. But we want every patient that walks into our clinic to feel like they matter, no matter gender or sex. Thank you, and I hope you've become informed about gender-based medicine. If you have any questions, feel free to contact me either by email or phone. Have a great day, folks, and see you later.